Thank you everyone for coming. We're here as the Minnesota Complete Streets Coalition, and I want to recognize just the many people around this room today. We have people from the health community like Blue Cross and Blue Shield. We have people from the faith community like the Lutheran Coalition for Public Policy, from the environmental community, Minnesota Environmental Partnership, from transportation communities.
In the last decade, 501 pedestrians and bicyclists have been killed on Minnesota roads. 20,000 pedestrians and bicyclists have been injured in that same decade. Complete Streets will make Minnesota roads safer for everyone who uses them. Everyone we think about who uses our roads, whether it's senior citizens, kids, people with disabilities, people riding bikes along the road. The goal is to make sure that we're designing our roads thinking of those people at the beginning, on the front end.
And because this proposal fits so well with the work that MnDOT is already doing and simply improves the planning process, one of the best parts is there will have no fiscal note, no cost to this effort. It's also important to note that this proposal does not require that existing roads be retrofitted. It simply asks that when roads or streets are being redone, that the needs of all users be considered in the planning process. This will ensure that the roads meet safety needs of all who use them. Planning for user needs at the time that roads are being renovated will prevent expensive fixes and upgrades in the future, hopefully saving costs over the long run.
Here in Minnesota, bad street design led to tragedy when an 86-year-old Chaska man was hit and killed by a car while trying to cross a notoriously busy highway to attend church. In 2005, older Americans made up 20% of all pedestrian fatalities. This is about safety.
We live close to the intersection of Highway 3 and Cliff Road, so we're right on the edge of Egan and Rosemount. We're lucky enough that my kids are able to safely bike and walk to school. We're also fortunate that we've got a brand new library just a few miles down Highway 3 in Rosemount, and just across South Robert, we're a couple miles from Lebanon Hills Regional Park. So with those facilities being so close, you would think it would be easy to bike there. But unfortunately, though, to get to either location, we have to cross these two busy roads. And that's the flaw in the system. Frankly, it's ridiculous to live so close to such great amenities only to have to drive to get to them. But there is no way I would consider walking or biking down either road with my kids. Traffic is going 50 miles an hour, there are no bike lanes or walking paths, and it's just way too dangerous. I wish these roads could safely accommodate biking so my family could get out of the car and onto our bikes. But the sad reality is I'd start my car up any day and drive because I'm not going to risk my kids' safety.
We need to take action now to reduce the obesity trend in Minnesota, because if we don't, our continued increases in obesity will add another $3.7 billion to health care costs in our state by 2020. Solving the obesity problem is complicated, and a variety of interventions are needed. One way to help people live healthier is to surround them with support. Adopting a Complete Streets policy is a perfect example of the kinds of support we need in our state. Safe roads support increased physical activity and better health by making it easier for people to get around on foot or by bike. Here's the bottom line. Our roads today make it difficult for people to be active. A Complete Streets policy is a creative solution that can not only make our transportation dollars stretch further, but it can save healthcare dollars. In these tight budget times, it's really a win-win on many fronts.